Good evening, friends, and welcome to another amazing episode on crossing boundaries. And today we are going to discuss on a very nice topic, and this is everything to do with your smile. So I'm sure all of you, are going to enjoy this topic, right? So let's get started. So good evening once again, and I'm sure you're excited that we have almost finished around 30 topics, and today we are talking on the topic called tooth veneers. Now, as you see in this picture, you can see there is a kind of a material which is placed over your tooth, and that is how a tooth veneer looks like from the front and from this side. So let's learn or understand a little more about the veneers. So here you're able to see a patient's mouth where you can see one side of the patient's mouth. You have, fillings or restorations, and these restorations are not very aesthetically seen, right? And on the other side, you can see nice white, pearly white teeth. So obviously, over these decayed teeth or irregular, broken teeth, or maybe discolored teeth, teeth which are not, taking, looking nice and bright. So today, with a lot of selfies and a lot of aesthetics, which plays the most important part, along with function, veneers has become a very important aspect of many people's practicing dentistry, right? So, what are veneers? If you look at it, they are like add-ons on the surface of the teeth, which can actually alter the shape of a tooth or the color of the teeth under it, and thereby you can see that you can give a much better looking smile for the patients, and this is so very important because aesthetics plays a very important role, and what we call this as a smile design. So you can see that right from the pink aesthetics of the gums and the white aesthetics, that is the teeth, we see a complete makeover. And here, you can do it either by either removing a little portion of the enamel, which is the outermost surface of the tooth, or in some cases, you don't even have to remove that, especially if your teeth are a little inwardly placed. And then you can just add on these veneers and you can share it with the patient. So these are usually done by the dentist in the dental office, and maintenance, of course, is done by the patients at home. So technically, if you look at these veneers, you have them when you generally replace teeth. You can do it either on a single tooth or multiple veneers. Generally, it's multiple veneers wherein you do all the six teeth in the front. So you first check the patient's smile, and then after understanding their smile, you generally take an impression and give for the central incisors, the laterals, and the canines. Sometimes even the premolars, so that the patient has a nice big white smile. Now, this can be removable in nature, reversible, and permanent, and you can choose from various styles of veneers that it is available. So, if you look at certain teeth, especially in the top picture, you can see the canines are very sharp. So, but this can also reflect on the personality of a person. So, you try to blend or mold it. So, if you look at the lower picture, you can see the canines are a lot more softer in nature. So usually these veneers, when placed, they last up to about, say, a decade or maybe 2, 3 more decades. And you can eat anything with these veneers. Just that you need to be careful not to eat very hard or not to exert a lot of shearing force. That is when you bite and you pull food away from your teeth. So that should not be done. And in case it is done, the veneers can get dislodged, can be broken, can be chipped, and thereby you see that you need to take care of those veneers a lot more better. So here you can put it either by the porcelain or the veneers that you can do it as with composite resins. So composite resin veneers, if you look at the veneers, it is most on the direct placement, where you do a direct veneers, and indirect veneers are when you make a preparation, take an impression, and send it to the lab, and then you wait for the lab have to complete the veneers and bring back. So porcelain is a glass, and so you should not give it a lot of shearing force, and that can shatter these veneers, right? And how do we go about it? We actually check the with a shade guide. We check the skin texture, skin color of the patient. We check the color of the lips, the gums, and then only go in for the teeth. So it's not that all the teeth which we give are white in color. So it's not that way, but then it really makes a lot of difference in the way we look at the the look of the tooth, right? So when we prepare the tooth, patient can complain about mild sensitivity, or they might feel a little uncomfortable in the beginning, but anyway, it is very short-lived, and then you can give these kind of veneers where the patient feels very comfortable and becomes a part of them. It becomes they can brush their teeth normally, they can eat normally, so it is not something that they're going to be conscious about. And ultimately, when you look at a lot of people with very good smiles, then you understand that most of them have got this kind of dental veneers done. Along with restorations, as in composite restorations, you can see a combination of a treatment which is done to get a very good result for a healthy smile. Now, as I had told you earlier, you can do this for either the 3 teeth on either side, that is 6 in total, or 4 teeth on either side, which is 8 in total. And this becomes very comfortable for the patient, and the patient feels very happy with these kind of teeth. And there are lots of advantages for this veneers. You can have a better appearance. It's long lasting. It protects the underlying teeth. It is stain resistant, so your teeth will not turn yellow. It is versatile and it's very natural looking. So many people are getting this treatment done. And just looking at this picture, you can see what a world of difference it's made to the person's face, right? There are some disadvantages also, which could be the cost factor, the irreversibility. Once you get the veneer done, it's not that you can get back your teeth. So then you need to keep changing the veneer. So that is there. Maintenance is there, and risk of damage and definitely tooth sensitivity for patients who are highly sensitive teeth, right? So like the veneers, as I told you, they are so thin. It's like your contact lenses that you can have, or very, very thin, very, very papery in nature. You can take it and then you can place it on the teeth with the help of a cementing medium, and the more you take care of it, the more you try to blend the teeth, and the more you're trying to help the teeth look good. I'm confident that all of you are going to have a great time having with these veneers. So they really last as long as you want to keep them there, right? And when you look at the smile which you get because of this veneers, it can really change the personality or the perspective that the patient has to look on, and they feel very comfortable either with their talking, eating, or doing anything, right? And they are just like your regular teeth, and that's how you would feel after a few days. So I'm confident that this session was also very useful to all of you. So do keep your queries coming in. It's such a lovely experience sharing our knowledge with you. Keep in touch, and waiting to serve you better. Thank you so much.